The Patient Partner Programme here at the University of St Andrews School of Medicine is a programme for volunteers to come in to talk about the health conditions that they have, as well as some of the care that they've received, and it's an opportunity for them to discuss that with students in an open and comfortable environment.
I think it's so important for the medical students today, who are going to be our future doctors and GPs and consultants, to have experience listening to patients and hearing their stories and learning how to ask good questions.
I'd had great experiences with what happened to me, but I'd also had bad experiences. And I am sassy enough to answer back when I have to. But I watched other people who didn't or who couldn't, and it's not fair. It's an important thing that you have to teach people constantly how to communicate.
Having been speaking to some students out with the classes, they have said that it really helps them being able to communicate with people who've been ill and get first-hand knowledge of the different diseases.
Oh, it's so important. You see, medical students tend to be very young, fit, healthy individuals and don't realise what's ahead of them. But when they're exposed to patients from different backgrounds with diversity, it makes them better physicians. They've got to be exposed to diversity, otherwise you'll wind up in a situation where you can only treat people who look like you.
All of us on the planet are individuals. We've all got our own backstories to tell, and unless we tell them, it's not necessarily obvious.
I think having the opportunity to hear from a wide range of people is really important for the medical students. They're going to have people from all sorts of backgrounds, ages, regions that they've grown up in, and being able to hear those stories and know how to listen, have some cultural understanding for those patients is really important. It's going to make them better doctors. It's going to strengthen healthcare provision for everyone.
There's nothing can replicate working with a real patient. There's nothing to beat actually talking to a real patient, listening to what they have to say.
It's crucial for medical students to hear from real patients because we don't know what's going on, but you have to communicate with us to tell us what's happening. And so learning how to do that, learning how to speak to patients is utterly vital, and learning how to speak like a human being to a human being.
I love being a patient partner. I love working with the students. They'll say, oh, that was really interesting. We really learned a lot from you. I'm going away to read up about your condition and things like that. And I always think, I've done my job here.
I think that hearing patients experience things that they've found negative and things that they've found positive is really vital so that we are able to better the healthcare system as a whole and also better the holistic approach to patient healthcare. So being able to think that's something I'm going to carry on in future, and also to think that's something I would like to change when I qualify.
If you're interested in joining the Patient Partner Programme, then you can get in touch with us and our Patient Partner Coordinator.